Kia ora again, good evening, welcome. Thank you. Gosh, you're so well behaved, I'm very impressed. Thank you very much. Let me introduce myself. I'm Steve McCloskey. I'm the president of the Wellington Multiple Sclerosis Society. President largely through a process of attrition, because I've been with the society for over 10 years now, and that's what happens when you hang around long enough. I'll just give you a little bit of housekeeping. Most importantly, I'd say that the fire exits are well signposted. Please just follow the staff to exit the building in the event of an emergency, earthquake, fire, flood, famine. We've all had lots of those recently, so I'm sure you know what to do. Could you please turn your phones to silent so that we don't get interruptions during the important people talking, so in the next few minutes. So I think bathrooms, that's another important thing. If you leave through these rear doors and go off to the right, there are male and female toilets off to in that direction. So without further ado, I'd like to welcome you all to this fabulous venue. Not our usual place for the Wellington Society to meet, but courtesy of our host tonight, which is Todd Stephenson MP. And I'd like to say thank you very much, Todd. Todd is the Parliamentary Private Secretary to Associate Minister of Health and the ACT Party's Health Spokesperson, which is a significantly longer job title than my own. So that's great. And without further ado, I'd like to invite Todd to come up and say hello. Thank you.
Well, thank you very much, Steve, and thank you all for being here, and it's my pleasure to be hosting you tonight in Parliament. Obviously, some of you had a busy day, you've got a busy evening tonight, and then some of you, I understand, have got the meeting continues for the next couple of days for some of you. So, look, thanks for coming along tonight. I've got a few of my parliamentary colleagues down the back. You've got Sam Uffendale, who's actually the chair of the Health Select Committee, and my parliamentary colleague, Cameron Luxton, that's Luxton with a T, who's also an ACT MP and is also on the Health Select Committee. But I'm sure some of our other parliamentary colleagues will pop in during the evening. Haven't seen any others, but they're likely to pop in during the evening. Which is just, I'm going to remind everyone, at 7:30, some bells will start ringing, and that's just because Parliament's still in session and we all have to go back to work. So I actually have to leave at 7:30. So I'm not being rude, I just have to go back and actually be in Parliament for the evening, and same with the other, some of the other MPs. But I want to actually thank, obviously, Multiple Sclerosis New Zealand, MS Wellington, and New Zealand MS Research Foundation for obviously putting together tonight. Obviously, there's also some sponsors who have contributed, so I want to acknowledge them too, because it's obviously important to have sponsorship. And events like this just don't happen. They obviously take time and effort. And as I understand it, really what the purpose of this is actually talk about a long-term commitment to improving the outcomes with people living with MS. And as I understand it, kind of on the path to excellence in MS care is broadly the theme. And I think that's a really admirable thing to be doing. So also want to thank everyone else who's come tonight. Obviously got people living with MS, clinicians, researchers, families, and other advocates. It's great to have you here, and I want to acknowledge all the work that you do. Progress in the space actually is about people showing up, like all of you in this room, and often that happens over many, many years. And again, as all of you know, we've got more than 4,000 people living with MS in New Zealand, but that number doesn't really capture the full picture of what it means for MS to our community and the people it directly affects, but their families, workplaces, and in fact, communities. So when we talk about people living well with MS, we want them to have obviously a connected and fulfilling life. And again, I think next year will actually mark 60 years, I hope I'm right about that, of MS organisations doing support in New Zealand. So that's really important. But it does show that obviously these things evolve over time, and what we might have been talking about 60 years ago is probably quite different to today. And again, I want to acknowledge all the people who have travelled. I think we have 18 societies around New Zealand supporting people with MS. And so, it's really commendable. But we want to make sure we obviously have a system that works properly. And I just want to say that we have heard, myself and others in this building, about the workforce challenges, and having one neurologist for 74,000 people is a stark number. So I just really think it's important that we acknowledge, that we have heard the issues around workforce, and that we need to seriously think about how we can improve that workforce and everything around it over time, because it isn't just obviously turning up to have a scan or go to a clinic. It's all the other things that go along with living with MS. And, again, people in this room will know much better than I do, but obviously chronic fatigue, emotional toll, having to maybe deal with your employing situation, other carer duties, all of those things. And so, we very much focused in government on trying to deliver better health outcomes. So we want to take those things that impact people seriously. And again, just to, talk a bit about the work that I've done with Minister Seymour in the medicines space, is we very much like to think about what are the benefits that new treatments can bring, obviously, to saving money maybe in the health system, but beyond that, what are the societal benefits that new treatments can bring? People returning to work earlier, being able to maybe take on more carer duties, etc. And so it is that whole holistic picture. And so it's really something we've been trying to challenge ourselves in government to think about. And so whether, it's diagnosis, treatment or support, obviously, talking about these changes, getting in place things early, it is going to make a difference. I don't think we don't have all the answers here in Wellington, I can assure you of that. So that's why it's really important to hear from, communities like yours about what you actually need, and we can try to respond to that. But again, I just want to say thank you for coming here tonight, bringing this group together. You've got a very interesting lineup of speakers. I'll stay and try and listen to as many as I can. And, they're going to obviously be sharing their perspective and their expertise, which is really important. And so I think everyone, is here for the right reasons, for the same reason, to try and improve the outcomes of people living with MS. But it's serious work, but I think, rightly so, we can be optimistic. People do want to engage on these topics and do want to listen. So, I look forward very much to hearing how tonight goes. But again, I just want to thank you all for coming, and it's my pleasure to host you here tonight.
Thank you, Todd. For those of you who don't know me, I'm Neil Woodhams. I'm the president of MS New Zealand. My wife has had MS now for 33 years, so it's a long haul. I'm a bit out of sorts because I spent 8 hours in the Koro Club today because my 8 o'clock flight got cancelled. But I did take the opportunity to have a bit of a rant, because it just occurred to me that the subjects that we're discussing tonight are things that have been very, very dear to my heart over a long time. And I'm glad that we have representatives of all sides of the House here tonight. The subject of our two presentations highlight very real issues faced by people with MS and people affected by MS and other chronic diseases. A critical workforce shortage and a fragmented system of treatment silos when a multidisciplinary team approach is required. Both of these problems are systemic. They span governments of all colours. And I think I've lost it in my files at home, but at one stage I was keeping a record of the names of all of the ministers of health that I dealt with. And I think it was up to 18 or 19, and it doesn't include any of the recent crop. And in fact, in 1993, I was staying a night in the James Cook Hotel, and there was a parcel on my bed when I arrived, and that was from management because I'd spent 50 nights in Wellington in 1993 on the health reforms of that time. I first became interested in the clinical workforce as a board member of the Clinical Training Agency in 1993. it was obvious to us that we had to do workforce planning. But when the chairman of the Southern RHA heard about it, he said, if you do workforce planning, we'll cut your funding. And we are seeing the results of that sort of attitude in the workforce, and I'm delighted that Rana's going to talk about it tonight. In 1998, I met with the then Minister, Jenny Shipley, with the heads of the 2 schools of medicine, with a plea to increase the number of medical students that they were allowed to train. A week later, the message came back, we've talked to Treasury, hiring doctors overseas is far more economic than training them in New Zealand, and the numbers were held in the same vein. I think the other thing, and I'm pleased, Todd, that you talked about the work you were doing with Pharmac, was you cannot separate our workforce shortage from the impact that Pharmac has. And if you think about it in particular for neurologists, you imagine for so many years treating people, not being able to treat people with MS with the latest drugs because they weren't funded. And there are still drugs out there, and I particularly mentioned cladribine as one, which is a pill which would avoid people going to hospital. They can take it for 6 months at home and then possibly never have to take it again. You know, we've been advocating that since at least 2018. So that's my rant for the day. But I do think this is a very, very appropriate place also for this meeting, because Todd, you mentioned that next year MS New Zealand celebrates 60 years. The driving force behind setting up MS New Zealand came from this building in the form of Esme Tomlinson. And Esme, I think I'm right, my political history of New Zealand is correct, was the second woman cabinet minister ever. I'm old enough to remember Dame Hilda Ross from Hamilton, who was the first, and Esme was the second. And sadly, we don't actually know why Esme was so passionate about MS. I've asked her trustees in Gisborne and have never got an answer. But she never married, she married but never had any children. And the Tom and Esme Tomlinson Trust has been a big supporter of MS, particularly in the Tairāwhiti region for a long time. So it just completes the circle. I do want to also join with Todd in welcoming our special guests, the parliamentarians, Dr. Jennifer Taylor, Dr. Evan Jolliffe, Dr. Leslie Kimpler, who's come all the way from Rotorua. Now that's a real one for the books, and I hope you get something out of this and make it worthwhile. I would also like to welcome Chris Higgins, who's the Chief Executive of the Rare Diseases organisation. Chris and I have been involved in this field for quite some time. He's a great advocate for research, which I am also, and it's good to see you, Chris. I also left off Imogen Milner, who's the specialist MS nurse here in Wellington. Welcome, Imogen, and you do a great job, and we hear about it all over the country, the job that you do, along with your other MS nurses. Really, really important, and another part of the workforce that is sadly too few, and but punch well above your weight. Can I have my presentation now? So just a little bit about MSNZ for those of you that aren't familiar. We're the national organisation. I say that we are the national organisation working with 18 interdependent organisations. The regional organisations are self-managed, self-funded, and by working together we are that much stronger. There are some things that are far better done nationally, and one is advocacy. And I think That's been an area where we've punched above our weight, and certainly are recognised in some circles as having done that. Information, we provide all of the nationally provided brochures and information on MS, and future-proofing, ensuring that we've got sufficient funds to ensure the ongoing viability of the business. There's where our regional societies are, scattered from the far north to the deep south. I was lucky enough to be in Invercargill a few weeks ago. Had great difficulty getting home, but that's a different matter, and on the west coast. But each of those regional societies are responsible for people with MS and their families within their regional group. Thank you. We're on a mission, and one of the things that I've been really emphasised is that whatever we do must be evidence-based. And so we've adopted and aligned ourselves with the organisation in the UK, Brain Health, and we're looking to maximise long-term brain health outcomes in any way that we can. We want to minimise the risk of progression and prevent disability. And the great thing, when my wife was diagnosed, she said, "Go home, there's nothing we can do for you, and hopefully it won't progress." Well, that was a vain wish. But today, I say to young people that I meet that are newly diagnosed, there is no reason, if you don't follow the rules, get the drugs, why you can't live a life free of disability. We're looking to reduce the burdens of MS physically, emotionally and economically, and to reduce the fear of MS through knowledge and awareness. So excellence in MS care looks like this: timely access to diagnosis, early treatment, initiation and ongoing management. And I just flag here, we are really concerned about the access of people with MS symptoms to primary care and then for on referral to secondary care. I'm a board member of an organisation that at the present time, every month, get 200 referrals to secondary care sent back to them. And these are people that the GPs have identified need help, but there is not the capacity within the health system to see them. So making sure people that have the early signs of MS get to see a neurologist is really critical. Effective and regular monitoring. People with MS should see a neurologist every year, and I know that doesn't happen in many places. Holistic support, and this is the multidisciplinary approach. It's no good just seeing the MS neurologist if you can't see the dietitian, the physiotherapist, the psychotherapist, and for some people, continence and sleep issues. Patients need to be involved in shared decision-making, and one of the things I think we've always tried to say to people with MS is take control of your MS. You're the best advocate, or if you're not a good advocate, make sure you've got somebody in your meeting with your health professionals who is a good advocate, and make sure that you're part of that decision-making process. Community supports, obviously, that's where the MS societies come in terms of providing access to education, advocacy and the community, and realistic access to funding support. Chronic health care conditions are expensive, and you'll hear me later, I got my letter today from the NASC person who's just reassessed Erin's care. And despite the fact I regard myself as reasonably intelligent, I had to ask her about 4 times to interpret exactly what she was offering and what it meant. And I can understand, for a lot of people, it would be very, very difficult to understand. The challenges in MS care, we've already talked about, a significantly under-resourced neurological workforce, and we're going to hear more about that today. a lack of consistent care pathways for MS, an underinformed primary care sector, and that's not a reflection on the primary care sector, because if you look at it, for most GPs, they may only see 1 or 2 people in a career of 40 years with MS. And I had a neighbour a few years ago who was a GP, and he would say to me over the fence, "Neil, I've got this patient with MS. You know more about it than I do. What should I do?" Which was always a bit frightening as far as I was concerned. We're falling behind, as I've mentioned, on treatment access. Challenges acutely affect with those with progressed MS, and that's access to physiotherapy, it's access to support, disability support. One of the things we'll talk about is I was going to say postcode, I don't like talking about postcodes, but we have evidence that the access to disability support across the country is very varied, and we'd like to know why that is. And as community-based organisations, we're always struggling for funds. The government, Todd, provides $300,000 a year, and that's for the provision of information. And I always wonder every year whether they're going to renew it, but they have renewed it. We've been lucky our contract fell due in an election year, and I think it was probably DSS couldn't contemplate the argument that would come if they cut it. So from the Brain Health Report, and if people haven't seen it, it's worth going on the internet and downloading it or reading it. We have the potential to maximise lifelong brain health. The key is to start somewhere. Even small changes can make a difference to individuals, families, societies, and economies. And I think that's where we come in. I think the other message for the members of Parliament to take back is that in this room, there are a lot of very dedicated volunteers who put in hundreds of hours a year, and I would hate to think what would happen if that wasn't happening. We also, of course, have our staff who equally are tremendously committed to what we're doing. But the work of the volunteers is really significant, and it would be nice for politicians occasionally to acknowledge that. We had an instance recently where a NASC assessor said to the husband of a woman with MS, "Toughen up, this is what you signed up to when you got married. This is for better or worse." Now, that is totally unacceptable. So that's my start contribution. I hope I haven't offended too many people. And if I have, come and see me afterwards, I'll talk it through.